Well, there's a very well-funded effort to make it really muddy in the United States in order to prevent people from realizing that almost any system would be better than the system we have. Now, you mentioned a few different arguments. We've got to really unpack them one by one.
Yeah, it's
And because the systems are so different in each country, there's no single criticism that is going to apply to all of the countries that are out there that have different systems. So Canada, for example, has a province-based system of care that is administered by each province.
oh, so they're different.
Well, they're administered at the provincial level. They're very similar programs, but they're administered in that way. And the relationship between the care providers and the provincial government is one sort of relationship. In other countries, you actually have governments that run the health facilities or that are administering the health facilities, which are still privately run, but the health insurance piece, for example, might be funded through taxation. So in order to really think about this, we have to have more narrow critiques. So like even when we say cancer survival rates are better in the US than in other countries, for example, we've got to talk about which country and what type of cancer, because there is no one answer to that. Oftentimes, cancer survival rates can depend on how sick are the patients at the point of diagnosis. How much early screening is there? Just because a survival rate is higher doesn't necessarily mean that it's because the healthcare system is better. It can be that for whatever reason, people are having a less severe form of that cancer, for example. So as you can see, it's super complicated and nuanced, and there's no sort of net that we can throw and say, here's 10 issues that I've heard, and let's kind of discuss it. We've really got to break them down one by one.
Do you think the fact that America is so diverse and so populated changes our conversation with specifically healthcare, actually probably even education too? A lot of these issues, the fact that we're so diverse, do you think that like changes anything for us that maybe other countries don't have to think about as much?
In what way would diversity affect it?
Well, don't, when it comes to health, like genes, genealogy, when it comes to education, us having probably so many more pockets of different subcultures, different states, cities within those states.
Well, let's think about healthcare first. So genetics. The idea, I want to make sure I understand the idea. The idea is that healthcare in the US is different than in some other countries in some way because of genetic diversity in the United States.
Oh, I'm just posing the question. I honestly have no idea of.
I don't know. Yeah,
answer.
I can't think of a way in which
Something
that
I've
would
thought
make a
about.
difference. Yeah, yeah. I'm not aware of any way in which that would make a difference. I mean, certainly having a larger population lets you spread the risk over more people, and the larger your risk pool when it comes to uneven outcomes. I mean, that's the thing about health care, which is that different people will have different healthcare needs throughout their life. A lot of people will have relatively small healthcare needs until very, very late in life. Other people will have acute healthcare needs at individual points due to injury, for example, or certain conditions. And then some people will have sort of very expensive chronic care for chronic conditions. And the more people you have across whom you can spread that risk, the better you can sort of anticipate what your total healthcare need will be. So that's one way in which having a bigger population would be good for transitioning to some kind of universal or single payer system.
And can you talk about like the state of Obamacare? And I'm asking from someone who genuinely knows very, very little about it, the successes and the failures of it. I think it's in a hard place because it's like trying to be a competitor, right?
It's a competitor to what?
To all the other options out there for everyone. But I feel like all I hear is that everyone's just like unhappy with it. Please,
right.
clear it up.
Well, so let's see. Obamacare does not provide health insurance. Obamacare mandated that everybody needed to have for-profit health insurance. So it's coming from all the same for-profit companies. So, or pay a fine if you opt not to have health care at all. That was called the individual mandate, which the Trump administration has done away with. in that sense, Obamacare was, interestingly, Obamacare was really conceived by the Heritage Foundation, a very conservative organization in the 90s, because it mandates tens of millions of new customers for-profit insurance companies. So the opposite of socialism, the opposite of left wing. It's
So their
saying,
incentive was purely monetary.
whose incentive?
The Heritage Foundation?
The incentive of the for-profit health insurance companies is that the government will say everybody has to go and get a for-profit insurance plan from these for-profit insurers.
Right. So their incentive was just monetary.
The insurance companies were standing to get tens of millions of new customers from that.
Right.
So the complaints about Obamacare, there's different complaints about Obamacare. One is that the premiums of the healthcare.gov plans increased from one year to the next. Mm-hmm. Now, the reason that's not a particularly interesting or unique criticism is that healthcare premiums inside of Obamacare exchanges and outside of Obamacare exchanges have been rising for decades in the United States. Like, that's the problem. The problem is that it continues to get more and more expensive every year for mediocre coverage, and people ending up having to pay more and more out of pocket. So it's true that premiums went up within the Obamacare exchanges, but they also went up outside of the Obamacare exchanges even more quickly. So that's not a very good criticism. The criticisms about the financial viability of Obamacare are not unfair, but they are significantly influenced by the fact that you need that individual mandate in order to make the system financially viable. And what Donald Trump came in and did was he said, well, you don't have to pay that fine if you don't get one of those programs. That's how actuarial calculations work, which is you have to have, everybody needs to be in the pool, so to speak. Everybody needs to be in the risk pool. And if you're not, there needs to be some financial compensation. Otherwise, the numbers don't work. So that would be a criticism, but that would be one that we should really be looking at Donald Trump for, because he's the one who ended that individual mandate. So it's, again, to say everybody's basically unhappy with Obamacare. Republicans had two plans that were so unpopular, which would have gotten rid of the Obamacare that supposedly everybody is unhappy with. And they were such obvious political dead ends that with a Republican president, a Republican House, and a Republican Senate, they weren't able to get it done because they didn't have enough Republican support, because Republicans realized this is way worse than what we have right now. And tens of millions of people are going to end up losing insurance.
Hey everyone, thanks so much for watching the episode. If you're interested in contributing to the conversation and supporting the show, there's two easy things you can do. One, click subscribe, and two, visit our Patreon page where you get exclusive access to the Exploring Minds community.